think you've done 2 reports on this. My feeling is it's you, Bob.
48 hours. We take you there. David is a bright and loving son.
He's a super kid.
But his life is ruled by fear.
I don't like people to touch the floor outside of my door.
He's so afraid, he's locked himself inside his parents' bathroom for 4 months.
There's me. This is where I sleep.
How do you get the food to him?
Under the door.
Under the door?
Erin Moriarty reports on anxiety out of control.
What do you do for 12 hours in the shower?
I wash myself.
Is there any way out? Plus, Andrew had a common childhood illness.
He was about 5 days into a strep throat.
But did it trigger something much worse?
The strep children have very rapid onset, with families literally feeling like they woke up with obsessive-compulsive disorder.
Peter Van Sant has Andrew's story.
Yesterday I was just a normal kid, and then you have fears of many, many things.
His life basically stopped.
And comedian Howie Mandel comes clean.
I'm obsessed about germs. Not mine, yours, and yours.
Just how fearful is he?
I built a house that I can go to when the family's ill. I'm probably the most happy, neurotic person in the world.
Obsessed. I'm Dan Rather, and this is 48 Hours. Imagine being afraid of the most common of objects, even in the most familiar surroundings. A faucet, a rug, a doorknob. Afraid even in your own home, completely overwhelmed by fear. Good evening. It is a paralyzing fear that has almost 5 million Americans in its grip, including up to 500,000 children. An all-consuming anxiety. To control it, most people develop a variety of repetitive, compulsive behaviors. But instead of conquering the fear, the whole syndrome can take even greater control of your life. It's called obsessive-compulsive disorder, OCD. Tonight we're going to show you some of the promising new treatments for it, and we'll report on the growing research suggesting this debilitating condition could even be triggered by a common childhood illness. We start with Erin Moriarty and the story of one young man who is truly obsessed, trapped behind a wall of fear.
When I think about the whole picture, what he could be doing and should be doing if this weren't affecting him, that's when I want to sit down and just cry.
Remember the mic I talked about?
He has so much potential.
I'd like to slide that through.
What you were about to see is disturbing.
Here comes the mic. Okie dokie.
When all the rest of this doesn't get in the way, he's super. He's my super kid.
Jackie's only child, 25-year-old David, has OCD.
I thought you touched the floor with your hands and stuff.
An obsessive-compulsive disorder. An affliction that makes him seriously afraid of things that would never bother most of us.
What's he afraid of?
He says it's contamination. It's not dirt. It's not germs. It's some imaginary contamination he's built up.
But the contamination is so real to David that he has actually locked himself up in a 5x10 room in his parents' house.
When was the last time you got to see him? I mean, here he is in your house.
I know.
He has been living behind this door in a bathroom for 3.5 months.
What I would like you to do, if it's okay, my parents will show you where there's a sink, and if you could wash your hands with soap and water.
Since he can't even open the door, David has agreed to talk to us from behind it.
You said you washed your hands?
Yes, he washed his hands.
Okay, I was afraid you said he washed his hand.
Oh, no, I got them both.
Okay.
It became clear he's not just afraid of getting contaminated.
I mean, are you concerned for me?
He's afraid of contaminating us.
Tell me what you don't want me to do.
I don't like people to touch the floor outside of my door.
Now, what about touching your door?
Oh, I don't like that.
Somehow, through all of this, he manages to keep a sense of humor.
No, nobody's going to be able to recognize you
Sure,
this
if I'm
way.
carrying the door.
If you ever walk outside with this door in front of you, they're going to know who you are.
I know him. He was on television.
Once David is comfortable, he explains why he can't come out.
I have to follow certain rules before I can open the door.
Who sets those rules?
I suppose I do. A part of me does, anyway.
I've tried to come out a number of times.
And what happens when you do?
It hasn't worked.
To just open the door, David believes he has to be contamination-free, which means elaborate cleaning rituals, including showers, which can last as long as 12 hours.
What do you do for 12 hours in the shower?
I wash myself. Very, very thoroughly.
It can be so time-consuming and painful that staying inside this tiny room is easier for David.
Your order, please.
But not for his mom.
I have tortillas, I have pita bread, I have applesauce, I have that cheese stuff.
How do you get the food to him?
Under the door.
Under the door?
Which presents an obvious challenge to the chef.
So you can only make him flat food.
Flat foods. Very flat. I care enough about him. I don't want anything to happen to him. I'll do what I have to. I know this entire situation is incredibly bizarre. Okay, you ready? The only thing I would want to say is that it's not completely insane because I still have my rational faculties intact.
Everybody go in the kitchen?
It's just that they're not entirely in control.
The thinking part of his brain is working okay. He knows that this doesn't make sense.
Dr. Michael Janicki, a neuropsychiatrist and expert on OCD, says David's case is one of the most severe he's ever encountered.
Imagine yourself having some kind of feeling that comes over you. All of a sudden, the feeling's overwhelming and it makes you panicky and you're just terrified.
You feel the same kind of anxiety you would if you were crossing the street and you saw a car coming at you. You didn't realize it was there.
You know cognitively in your head that that's not true, but that feeling's so scary that you have to act on it.
Dr. Janicki says there is a physiological reason for David's severe anxiety.
Where exactly is the brain affected when you have OCD?
We can see on the underside, above the eyes, there's a part of the brain called the orbital frontal cortex.
That's the part of the brain which controls judgment and planning.
Maybe some other part of the brain, deep inside the brain, is not functioning right, and this part of the brain is overcompensating for that, and by overcompensating, it's producing these worries.
David's symptoms began when he was 8 or 9 years old.
Our teacher was talking about hygiene, about how, you're supposed to wash your hands after you use the toilet.
And that made a big impact on you.
Right, because that means that if you wash your hands to get them clean, and then turn the faucets off with your hands, you get it back on your hands again, and you may as well not have washed them.
He became afraid to touch doorknobs.
I was standing outside the door to my second grade or third grade classroom thinking, how am I going to get in there?
Because you couldn't touch the door handle to walk in.
I just figured I'll pull my hand way back into my shirt sleeve and then open the door with my shirt sleeve.
Jackie and her husband Paul took David to a doctor who decided his parents were the ones who needed help.
They told us, well, it's a family problem.
What do they mean by a family problem? Psychological?
Dysfunctional family, maybe.
David was not diagnosed with OCD until he was 15, and since then has tried to control his symptoms with medication. Despite his disorder, he managed to live not just an ordinary life, but some would say an extraordinary one.
David is the best student I have had in 30 years of teaching.
David took college philosophy classes from Professor David Annis while he was still in high school.
Here was a high school student. He was the best student in the class.
No.
Yes, absolutely.
An honors student, David went on to a college he'd rather we not identify, hoping to get a PhD in philosophy. But last fall, his fears became so overwhelming that he dropped out of school, and in October, he disappeared behind this door.
I finally just broke down and said, I can't deal with it anymore. I can't come outside for a while. I'm going to take a vacation from contamination.
And that's what you're on, a vacation from contamination inside there.
It started out that way. Now it's not a vacation anymore. The longer I've been in here, the more complicated the rituals for being in here have become, to the point where now it's not that much better. Hello?
Even from behind this door,
You have a phone in there?
David is not completely cut off from the world.
David, you want to play a little chess?
Sometimes I get to play chess with my dad. We call out the moves so that we don't have to share a board. Do you want to exchange a little bit of pre-game banter?
Do you have a board in there?
I made one out of styrofoam plate.
His father is a map librarian at a local university.
I think what's tragic is that if it went for the disorder, he'd be flourishing now.
Interesting play.
It was blocking my bishop.
When you'd like to be able to do something you don't know what to do or how to do it and doesn't get any better, it's frustration.
Jackie is now counting on two men she has never met for help, Dr. Janicki and psychologist Lee Baer. They run the OCD Institute at McLean Hospital in Boston, one of only 2 residential treatment programs in this country. But David will have to leave this room, which he says he'll do in 10 days. The problem is, he's made this promise before.
You didn't even come out on Christmas Day.
I couldn't do it.
That's why the tree is still up?
This time, if David doesn't come out, Jackie wants Dr. Janicki and Dr. Baer to come and get him out.
You honestly think you're going to come out before February 1st?
I know I'm going to try because I don't like the idea of doctors being sent across the country just to get me. I find that sort of embarrassing.
But will David be able to do it?
Do you feel this is your last time?
Yes. If they can't help him, none of us know where to go.
Later on 48 Hours.
The longer I've been in here, the more complicated the rituals for being in here have become.
If David ever does walk out that door, there's hope he can be successfully treated. Outside Milwaukee, Wisconsin, Dr. Brad Riemann treats patients with symptoms similar to David's.
The results can really be quite dramatic.
At one of the newest OCD therapy programs in the country at Rogers Memorial Hospital.
About 85 to 90% of the people who come through our program have been able to significantly reduce these symptoms.
Here, patients who are typically treated with traditional medications to reduce their anxiety also undergo something called behavioral therapy, a 1-2 punch to battle their disorder.
You develop a very systematic and structured series of exercises.
48 Hours was granted exclusive access.
We are trying to show people the world is not a dangerous place.
For a first-time look at patients undergoing this treatment.
It was a 0.
It was a 0. You could do that with no anxiety.
Right.
Patients like Mary Ellen Friedel.
How are you doing now?
And Jeremy Lyons.
There are germs on that doorknob. If I touch it, I can become seriously ill.
Jeremy Lyons is 16.
Pretty much as far back as I can remember, I've had some OCD symptoms.
A 10th grader from a Milwaukee suburb.
My dad.
Did you ever tell anyone about these symptoms?
No, I just thought I was weird.
2 summers ago, his OCD suddenly worsened.
The walls and ceiling close in on me.
To the point his own mother...
Bye, Mom.
Bye-bye. See you later.
...no longer recognized him.
It's like Invasion of the Body Snatchers. It's almost like an alien took his place.
Jeremy's overwhelming fear of germs took over his life.
He was one of the worst contamination folks that we have seen in quite a while.
His showers lasted for hours.
This is the evening medication.
Like Jeremy, Mary Ellen, a 59-year-old widow and grandmother,
this is Xanax to be used when there's high anxiety.
Has fought OCD since she was a child.
Obsessions have been controlling you since you were 7 years old?
7 years old.
7 years old.
7 years old.
And like many patients...
You would come down here and clean the pipes?
Right.
She hid her illness for decades.
It wasn't something I wanted other people to know.
Until the struggle nearly became too much to bear.
I was left with the feeling, I just don't know if I want to live till 70 or 80. Really.
As a last resort, she came here.
I'm 59, and these obsessions and compulsions have tortured me all my life.
Mary Ellen has identified at least 125 separate obsessions.
These are all your obsessions and compulsions.
Washing compulsions, doubting obsessions, religious kinds of obsessions.
4 pages of your obsessions and compulsions.
Right.
She had extreme picking behavior.
It hurts you.
It hurts me. But because the anxiety is so high, I have to keep on going.
But after 5 months of behavioral therapy, Mary Ellen says she's improving.
That exposure will, with time, reduce the anxiety, and you'll say, I don't have to do that.
Before the therapy sessions can begin, Dr. Riemann has the patients list all of their fears, from certain items that they're afraid of to situations that cause them anxiety, and rank them on a scale from 1 to 7. 1 being the least difficult, 7 producing the most anxiety.
You have to start slow, like baby steps as a child.
To combat her behavior, Mary Ellen is assigned a series of exercises.
It's a prolonged exposure, so I want...
First, Dr. Riemann has her stare at her fingers for 15 minutes, resisting the compulsive urge to pick at them.
By exposing her to that and then asking her not to pull or pick or whatever it might be, that she's going to overcome this problem. Try out the bathroom door handle.
Then, Dr. Riemann works on an exercise with Jeremy.
Our goal is to continue to get closer and closer to that door till the...
That's designed to help him confront his fear of germs.
My stomach starts to jump.
By touching a doorknob.
And my heart starts to pound.
Our ultimate goal, of course, is to come in contact with these door handles and not wash his hands.
I'm going to have to try to park as close as I can to that white car.
Mary Ellen's next test is parking her car.
That is my car.
For years, she has obsessed over accidentally hitting cars next to hers.
Now, if I'd known I should have washed this car.
Then she has to check and recheck over and over again for any damage.
I used to stoop down and go like this, then I'd go up here and look, and I'd pop up to see if anybody's looking for me, and then I'd go back down and look some more.
She pulls up alongside our rental car and, as instructed, opens the door.
Oh.
But taps our car.
Okay. How's your anxiety?
About a 4 or 5. If you folks weren't standing here, I'd be going and checking that car.
Oh, I know you would.
An hour and a half later.
You want to know what my anxiety level is now?
Yeah.
Mary Ellen is still fighting the urge to check the car for damage.